Hi, this is Rich Sanders with the Southern Health Lawyers Weekly Health Law News Nugget for April 10th, 2018. Well, last week was a big week for healthcare reform as open enrollment concluded earlier this year and CMS put out its report for final enrollment. And then additionally, yesterday was a big day at CMS with new rules issued regarding enrollment on the healthcare exchanges for the upcoming year beginning later this fall and covering policies for 2019. Last week, CMS reported that the full open enrollment year, which concluded earlier in February, totaled 11.8 million Americans. That's a good number for the administration because it shows consistency over time, but ultimately many commentators were looking at those final numbers that came in last week and said it's really not on track with where at least the Obama administration and the Congress that put this law into effect in 2010 hoped the trajectory would end up. With 11.8 million Americans covered on the exchange, it's good progress. Those are people that have health insurance that might not otherwise get them because of the subsidies that are available on the exchange, but ultimately fall short of the goal that the federal government established in 2010. And of course, now we have a new Congress and a new administration that are actively working on a repeal and replace strategy, despite the fact that no congressional efforts were successful in 2017. So, enter new proposed rules from yesterday up in Washington, where Seema Verma, the administrator of CMS, issued two proposed rules that will affect the exchanges for the open enrollment season coming up and policies that cover 2019. Those two rules carve out big exceptions for folks who are buying health insurance policies on the exchange and basically mean that even though the tax reform law passed by Congress in December ultimately means no penalties will be assessed by the IRS to Americans who have no health insurance policies starting in 2019, these new rules carve out such broad exceptions that many folks will not have to pay penalties either in 2017 or 2018. The two exceptions are the following. The first is folks won't have to buy health insurance if they live in a county where only one policy is offered on that exchange. Now this so-called one policy rule is also called a hardship exception, where folks who live in a county, say for instance, where just this one type of health plan is sold and have no alternative on the exchange that covers them in that county, can say, I have a hardship and therefore shouldn't have to buy health insurance. The other is a lot more controversial and based on some Supreme Court and policy decisions that have been discussed by the Trump administration a lot recently, focusing on the right of self-expression and religious freedom under the Constitution. The second exception says that for folks whose only option in a county is a health plan that covers abortion, and that is offensive to them for their religious beliefs, that also gives them the key to a hardship exception. The first one is probably everybody going to be the one that covers many Americans. CMS reported in the process of releasing this new proposed rule that nearly half of all counties in the United States that have exchanges have only one health plan being sold in that particular county. In other words, it's a loophole that you could drive a truck through, and many Americans are going to be able to take advantage of this hardship exception and not have to pay health insurance, pay penalties for not having health insurance plans for both 17 and 18. The rule is retroactive. Thanks so much for your attendance today and watching the Health Law News Nugget. I'm Rich Sanders with Southern Health Lawyers. We'll look forward to seeing you next week.